Hey, it's Dr. Toker, your friendly neighborhood colorectal surgeon, and I just want to direct this conversation right now to people who are probably dealing with, or their loved ones, dealing with colon cancer, because it can be a very scary thing to hear, and it's my least favorite thing to tell patients when I discover a colon cancer. I personally have had melanoma, so it's not colon cancer, but I can kind of empathize with hearing for the first time that you've got a malignancy. So my job here today is to try to give you some form of hope. First of all, colon cancer is a very survivable disease. It's a very preventable disease, and we'll cover that in a different video, but it's a very survivable disease. It's very slow growing for most people. And so if you're just now getting the diagnosis of colon cancer, I don't want you to lose all hope. Let the doctors do their staging process to figure out which stage you fall in, and then follow the prescribed treatments. We've come so far with colon cancer. I have patients who I have met with metastatic cancer that are still alive 6 and 7 years later because modern medicine helps, proper nutrition helps. What I really want to discourage is someone who is so fed up with doctors and big pharma that they say they don't want to do chemotherapy, or they don't want to take the treatment, or they don't trust the doctors. I understand. And the last 4 years has really damaged the reputation of the medical field, and I certainly understand that. But I have seen patients make this decision, and it is the most horrible decision I've ever seen people make. So I would just encourage you to find your faith, find your family, find a doctor that you like, that you can communicate well with. Look for all of your options. Informed consent is super important. But just know, you can live a very long time with even advanced colon cancer. I would truly like the population listening to this video who does not have colon cancer to hear my words and think, man, I don't ever want cancer. Cancer sounds terrible. And it is. And so we're going to talk about colon cancer screening along the way. This is March, Colon Cancer Awareness Month. And I really hate seeing people struggle with this disease.